Hello, welcome to our transitional year residency program in Mountain View Hospital, Las Vegas, Nevada. First, I want to congratulate you to be selected for our interview process. Second, I want to wish you success in your interview with us. And third, I want to wish you success in your future career as a physician. Mountain View Hospital has been named as a top teaching hospital by the Leapfrog Group. The Leapfrog Top Hospital Award is widely acknowledged as one of the most competitive honors American hospital can receive. The top hospital designation is awarded by the Leapfrog Group, which is an independent hospital watchdog organization. The top hospital award comes following the hospital's A Hospital Safety Grade, also from Leapfrog Group. So I just want to tell you about the future hospital in which you are going to train, which is extremely good in quality and safety type of hospital. And our hospital, together with Sunrise Hospital and Southern Hill Hospitals, are part of Sunrise Health Graduate Medical Education Consortium. Basically, our transitional year program team has a couple of members. My name is Dr. Andrey Manov. I'm Transitional Program Director at the Sunrise GME in Las Vegas and core faculty in the sponsoring program, which is the internal medicine program. I'm double boarded, certified in internal medicine and endocrinology, diabetes and metabolism, and professor of internal medicine in the local Touro University of Nevada School of Medicine, and also of University of Las Vegas, Nevada, as well as Burnett School of Medicine in Fort Worth, Texas. Our program coordinator, who will be the one who you are going to communicate very often with, is Mr. Joe Plachetta. He is our program coordinator of the TY residency program in Mountain View Hospital, Las Vegas, Nevada. Here are our core faculty, Dr. Shetty, who is internal medicine program director. As you know, every transitional year residency program has to have a sponsoring program, and our sponsoring program is the internal medicine residency program, in which Dr. Kartika Shetty is program director. The other core faculty is Dr. Nancy Rivera, which is program director of the surgery residency program. And the third is Dr. David Hart, which is program director of emergency medicine program. So these are basically the core faculty of your core rotations during your residency program. The core rotations are in internal medicine, surgery, and emergency medicine, as we are going to talk in a moment, as well as in ambulatory clinical settings. The other core faculty is Dr. Burgis Ahmed, which is also graduate of UNLV, Dr. Dom Pepito, Dr. Hatim Jamil, Dr. Pinak Shah. You will basically interact with them while you are on the wards. You will interact with me while you are in a medicine continuity clinic, and with the four of them you'll contact while you are on basically medicine rotation, on the ward rotation. And Dr. Curious, which is basically you'll interact with her when you are on night shifts in internal medicine. So these are basically our core faculties of the program. The sponsoring institution, as I mentioned, is Mountain View Hospital, and we have, and the sponsoring program is internal medicine program. We have 13 in Mountain View Hospital transitional residents. And as I mentioned, the core rotational internal medicine, general surgery, and emergency medicine. We have a lot of electives like anesthesiology, PM&R, rheumatology, neurology, sleep medicine, pulmonary medicine, radiology, orthopedics, ophthalmology, cardiology, endocrinology, GI infectious disease, nephrology, and hematology oncology. We have 13 blocks. Each block is around 3 weeks, except surgery, emergency medicine, and ICU, where you have blocks of 4 weeks. You have basically co-rotation. The requirements are 24 weeks and minimum 4 weeks or 140 hours continuous in basically you need in emergency medicine and ICU, as I mentioned, and 4 weeks, 140 hours at least in our ambulatory care clinic. It's internal medicine, ambulatory continuity residency clinic, and you have 4 weeks vacation. But these are basically your core rotation: surgery, emergency medicine, and internal medicine, as we mentioned. Traditional residents attend department didactics of assigned rotation in emergency medicine, general surgery, and internal medicine. Basically, when you are in emergency medicine and general surgery, you don't need to come to internal medicine, basically didactics, because they have their own didactics. Also, some rotations, elective, like, for example, radiology, have their own basically didactics, so you may not come to the internal medicine didactics during this rotation, as well as endocrinology has certain days in which they have their basically didactics. So on those days you don't need to come to internal medicine didactics. In all other rotations which are on site, meaning in Mountain View Hospital, you have to come to the medicine didactics, which are usually noon conferences, which are every day from 12:30 to 1:30. During these noon conferences, we have usually resident ground rounds. Also, we have usually journal clubs on Thursdays, academic half days, which is Tuesday afternoon, in which the residents may present their resident ground rounds. Usually the residents present some interesting case from the floor or from the clinic. There are mortality and morbidity conferences. I'm basically leading them, which are basically for requirements for our safety, and it's for the cases from the clinic or from the hospital, and it's led by me and by upper level basically internal medicine residents, and the TY residents participate in all M&M conferences. Then there are faculty ground rounds, patient safety conferences, and simulations as well. Usually on Mondays we have ambulatory curriculum from 12:30 to 1:30, in which I present a certain topic with questions and answers. You need to be pre-prepared for this basically ambulatory curriculum on Monday. Tuesday usually we have academic half day, and Wednesday, Thursday, and Friday you have the noon conferences, and they're absolutely required. You have to achieve at least 75% attendance in these noon conferences, as discussed, unless you're on emergency medicine, surgery, as I mentioned previously, or on certain electives like radiology or endocrinology, or you're working during the night, obviously, or you are in a rotation which is outside Mountain View Hospital. You don't need to come to the internal medicine, basically didactics. TY residents needs to take USMLE Step 3 or complex USA Level 3 before the completion of the academic year. So you need, as soon as possible when you come to the program, to apply so that you assure a spot, because this is a requirement of transitional year program as well. Mountain View Hospital GME residency program, which we have in our hospital, besides our transitional era and anesthesiology, emergency medicine, OBGYN, PM&R surgery, and radiology. In Southern Hill Hospital, there is a family medicine, psychiatry, neurology, and transitional year. Our TY residents go for certain electives like gastroenterology or neurology in Southern Hill Hospital, which is located around 15 minutes from Mountain View Hospital, which is your hub. HCA, our history from the beginning. HCA Healthcare founders, Dr. Thomas Frist and Sr. and Dr. Thomas Frist Jr. and Jack Mackey envisioned creating a healthcare company with the scale, resources, and clinical expertise to deliver patient-focused care in communities across the nation. In 1968, they formed what was known as the Hospital Corporation of America, one of the first hospital companies in the United States. More than 50 years later, HCA Healthcare is community of caregivers dedicated to our mission. Above all else, we are committed to the care and improvement of human life. So HCA Healthcare is one of the nation's leading providers of healthcare services and is comprised on 186 hospitals and more than 2,000 sites of care, including surgery centers, freestanding ER, urgent care centers, diagnostic and imaging centers, walk-in clinics, and physician clinics in 21 states and in the United Kingdom. With its foundation in 1968, Nashville-based HCA Healthcare created a new model for hospital care in the United States. So we have 280,000 colleagues, 98,000 registered nurses, 46,000 active and affiliated physicians. We are dedicated to patient care. U.S. hospitals provide approximately 5% of all inpatient hospital services in the country. In 2019, we had 35 million patient encounters, 9.2 emergency room visits in our hospital sites, and 220,000 babies delivered. Giving back 4.2 billion invested in 2019 in capital spending in the communities we serve. 3.7 billion estimated 2019 cost for the delivery of charity care, uninsured discounts, and other uncompensated care to bridge the disparities in healthcare delivery. 45 million in charitable cash contribution provided across the enterprise in 2019. HCA is industry leader. Sarah Cannon, the Cancer Institute of HCA Healthcare, provided state-of-the-art cancer care close to home for hundreds of thousands of patients, a number unmatched by any single cancer center. HCA Healthcare affiliates deliver healthcare services in more than 170 languages and dialects, again to bridge the gap in healthcare disparities and the healthcare disparities. HCA Healthcare continues its comprehensive program on environmental sustainability to promote energy and water conservation, green building initiatives, increasing recycling, and environmentally conscious purchasing. Our residents and fellowship programs are in 58 hospitals located in 15 states, as you can see, residents and fellowship programs, HCA Healthcare hospitals. So raising the bar, we have national ground rounds, significant investment in simulation resources. The HCA has collaborative mass casualty event team training and unique robotic surgery curriculum, quality and patient safety. So largest sponsor of GME in the United States, more than 250 residencies and fellowship HCA GME has, and 58 teaching hospitals and more than 4,200 residents and fellows. Really impressive results. So our goal is to recruit quality medical students like yourself, train quality residents and fellows, which you will become, and retain quality physician in our communities. So Mountain View Hospital is primary teaching science and sports in an institution in Las Vegas, Nevada, in HCA, is an HCA hospital, as I mentioned. Mountain View Hospital has, as I mentioned in the beginning, been named as a top teaching hospital by the LEAP4 group. Diverse patient population and wide pathology. We see Mountain View Hospital serves Las Vegas and North Las Vegas, attracting patients from multiple neighboring smaller hospitals, freestanding ERs, and urgent care centers. A specialty offered by our hospitals is internal medicine, and we have most internal medicine subspecialties: OBGYN, general surgery, orthopedics, neurosurgery, cardiac services with STEMI Center, EP Lab, cardiovascular thoracic surgery, podiatry, ENT, urology, ophthalmology, interventional radiology. Rehab services are ancillary services which we have, like physical, occupational, and speech therapy, lab services, radiology, and case management services. Team structure. When you are going to be on internal medicine team, usually we have one senior and two interns, an attending physician, and one senior internal medicine or other resident in your core rotation, like surgery rotation, for example. We have medical students in the medical teams from UNLV, Onturu School of Medicine, and we have visiting students. We have in internal medicine 5 ward teams. They are on call from 1 p.m. to 5 p.m. Protected time is from 7 a.m. to 1 p.m. Call alternating every 2 and 3 days consecutively, 3+1 model, and we have one night float team under the supervision of Dr. Curious, which is the core faculty which I mentioned in the beginning of my presentation. Nuts and bolts, you need to, as a future residents, take care of the admissions, handoffs, and continuity ambulatory clinic, where I practice. Basically, you will be there together with me and with the other attending physicians and senior chief resident. In ICU, you have to spend 4 weeks per year, includes ICU day and night floats, and there is a call system. In emergency medicine, as I mentioned in the beginning, is 4 weeks. These are the core rotation, internal medicine, emergency medicine, surgery, ambulatory clinic, and basically surgery. So you have to spend 4 weeks per year, attend didactics with EM residents, and shift work. Here you don't need to come to internal medicine didactics, as I mentioned previously. General surgery, again, 4 weeks per year, core rotation, only day shifts, no night shifts. Attend didactics with surgery residents, not with IM residents when you are on this rotation, as well as in ICU, you are excused for internal medicine rotations, as I mentioned in the beginning, or if you are off-site, or if you are during the endocrinology rotation, as well as during radiology rotation. You go to their basically didactic sessions. Internal medicine subspecialties, we have cardiology, endocrinology, gastroenterology, infectious disease, neurology at Southern Hills. So these are your elective rotation. Hematology, oncology, pulmonary, rheumatology, and electives. We have other electives which we can have is ophthalmology, orthopedics, PM&R, psychiatry, sleep medicine, wound care, palliative medicine, radiology, POCUS, emergency room POCUS, and anesthesia. These are all your electives in IM subspecialties or other electives outside the internal medicine. These are your electives. So the first was your core rotations, as I mentioned, internal medicine floors, internal medicine clinics, internal medicine intensive care unit, emergency medicine, and general surgery. These are your core rotation, and these are your electives. You have to spend, as I mentioned in the beginning, at least 24 weeks in your core rotations. Usually you spend 4 weeks emergency medicine, 4 weeks in surgery, 16 to 20 weeks on the internal medicine floors, 4 weeks in an intensive care unit, and at least 140 hours, which is around 4 to 5 weeks in ambulatory internal medicine clinic. Didactics in internal medicine, as I mentioned, noon conferences, academic half days on Tuesdays as discussed, M&M conferences, which are usually done in academic half days, journal clubs, resident ground rounds. We have ground rounds. We have obesity management series, handshake rounds, ACP Jeopardy, and our ambulatory curriculum, which I lead on Mondays at between 12:30 and 1:30, and also I'm lead the M&M conferences, which are presented in our academic half days. As I mentioned, the presentation will be from the clinic or from the wards, from you and from the senior level internal medicine resident. Research, you are required to do basically one research project. We have a research director on site who is also biostatistician. You can do a case report, you can participate in prospective study, you can do posters on your M&M presentation case on academic half day. You may make a poster and present it at the end of the year. We have in May, the following year after you start the residency, we have the Far West Symposium, and you can present your poster there. It's always counted as an academic activity. Local and national meetings, you can participate. If you have started some project as students, but you finish it while you are resident with us and you work while you are resident with us, we also count it as your research progress. I just want to mention our quality improvement project. The Mountain View Hospital Transitional Residents won 2 years in a row, 2022 and 2023, the Far West Research Symposium first place with our continuous glucose monitoring project for improving the quality of care of patients with diabetes mellitus type 1 and 2, multiple injection of insulin per day. And now we are moving the project to prospective trial. We are applying to IRB, and 5 transitional residents participate with me and with internal medicine residents in this very interesting project of improving the quality of care in our internal medicine and residency ambulatory continuity clinic. We have basically started this project approximately 3 years ago, and we monitor the patient on our computers, their continuous glucose monitoring, and we adjust their insulin by calling the patient every 2 days and seeing the patient once every 2 months in the clinic. We have a simulation center on site. As I mentioned, HCA is involved with development of simulation center. The new facility contains advanced education audiovisual technology used in training internal medicine and TY residents in a controlled simulated environment to recognize and manage commonly clinical conditions encountered in the real world. The education space is comprised of 2 fully equipped patient rooms, a debriefing room, laparoscopic stimulation room, and high technology surgical procedure lab. These rooms also have the capabilities to convert to patient rooms, which are built to simulate the reality. So this is the endoscopic trainer on the left-hand side and CMAN on the right-hand side. CMAM and anesthesia machine and surgical OR table we have also in our simulation center. Duty hours and fatigue. Clinical and educational work hours must be limited to no more than 80 hours per week, average over a 4-week period, inclusive of all in-house clinical and educational activities, clinical work done from home, and all moonlighting. Wellness. We have a wellness curriculum. Monthly wellness activities include bowling night, movie nights, Halloween parties, Christmas party, and transitional class reps are part of the wellness committee of the hospital. The class reps, you have to basically elect the class reps. Usually we elect 2 class reps, which will be a part of this wellness committee of our hospital. I'm also part of this committee as well. Healthcare disparities. The program pays special attention to the healthcare disparities. The residents are required to complete a module from our Johns Hopkins ambulatory curriculum site and implement in their practices the healthcare disparities to improve the health of disadvantaged people and minorities as well, to bridge the healthcare disparity gap. Paid time off. All residents will receive 20 days paid time off for academic year to include the following: vacations, sick time, interviews. Educational materials. We have at Johns Hopkins Physician Education Assessment Center, HCA Healthcare, and up-to-date, which you can basically have for your preparation. Food allowance and stipends. Food allowance, daily allowance for use in hospital cafeteria you have, and free food and drinks in residence lounge stocked daily. On call meals, $475 paid in July and $475 paid in January. Orientation is currently $500. Other perks: equipment provided, cell phones and data services, laptop, free employee badge, restricted parking, ample residency workspace, call rooms, and ACA perks. You can find them on abeniti.com. Where to live? Rent: apartment, condos, 2-bedroom is between $850 and $1,700 range. There is a link which you can go and we can look for homes. Buy for the ones which who want to continue staying in Las Vegas, or they have already matched to the program in Las Vegas. They can buy condos. Is between $100,000 to $200,000, or house $400,000 or above is the price. We have a unique nature surrounding Las Vegas, like Red Rock Canyon, 20 minutes away. You can hike there, do the rock climbing, biking. It's beautiful. Las Vegas is not only the strip, but we have a unique nature as well. Unique nature is surrounding Las Vegas, as I mentioned. Lake Mead. It's 30 minutes away. You can do from the hospital, you can do hiking, camping, boating, water skiing, biking, and there is the renowned Hoover Dam as well. Have other unique nature is Mount Charleston, 50 minutes away. You can do hiking, camping, snow skiing, backpacking as well. We have Valley Fire State Park as well, 30 minutes away from here, in which you can do hiking, camping, Indian you can see the petroglyphs, and geological wonders are there as well. Shopping, ultimately luxury of premier outlets, which we have in Las Vegas, as you can see. Culture and Museum, you see on the left upper hand side the Smith Center, in which there are a lot of productions there. The Mop Museum is also here, among others. Downtown, there is a Fremont Street, the renowned Fremont Street, which you can also go and enjoy in your free time. Sports, as you know, the Golden Knights, the hockey team, won the first place last year, but we have also the Raiders and Las Vegas Aces. Temperature, usually in the winter is mild, usually, as you can see, between 58 and 39. Once or twice in the last 4.5 years, it dropped to 32. And then the summers are hot. The temperature may go occasionally. Average is 104, the highest in month of July. Usually the hottest month is July, but there may be occasional days in which the temperature can go to 110, 115. Harry Reid International Airport, we have with ability to travel all over the world. Virtual interviews, this is the third year doing virtual interviews. Please pardon for any technical glitches which we can encounter. If by any reason you get disconnected, do not worry or panic. The phone number you provided with your ERAS application, keep the phone near you so that we can contact you directly during the interview. If any issues arise with Zoom, this happens extremely rarely. This is my third year of interviewing. It happens once or twice, so don't worry. We can also reschedule the interview if needed, if you have other interviews or engagements. Questions, I will come after this presentation, and you can answer me any question, or you can ask me questions during the interview. I always give 2-3 minutes from you are allocated 15 minutes for interview for your questions. So be prepared, and you are more than welcome to ask me any further questions. It was my pleasure to again congratulate you for making it and being selected to our interview session, and wish you luck with your interviews with us and your future career as a physician. Thank you for your interest in our program.